Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. To start, in the spirit of promoting reconciliation and gratitude, and in keeping with the calls to action from the Truth and Reconciliation Commission, on behalf of the Board, I would like to take this opportunity to acknowledge that the work of Alberta Health Services takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. I would also like to acknowledge the 46 First Nations communities within what we call Alberta, as well as the Métis and Inuit peoples who form an important part of our healthcare system. Our board members are joining us from across the country, and we acknowledge the Indigenous peoples' territories in which they live and work. We are grateful to those who have come before us and mindful of those who will follow us as we steward and protect these lands. Before I address some administrative matters, I'd like to share some good news with you. Last week, Alberta Health Services was named one of Canada's best diversity employers for the third consecutive year. This award recognizes employers across the country that have exceptional workplace diversity and inclusiveness programs. I'm pleased AHS continues to receive national acclaim for ongoing efforts to develop programs, supports, and resources that address the diverse needs of all Albertans, including our own workforce. Alberta, after all, is a province rich in diversity. As I have said before, AHS wants our people, our patients, and our families to feel safe, welcomed, and valued at work and in their healthcare experience. It is important for the board and for Albertans. I should point out this diversity award arrives just weeks after AHS was named one of Canada's top 100 employers, one of Canada's top employers for young people, and one of Alberta's top employers, all for the fourth consecutive year. I would like to thank everyone involved in AHS's continued efforts to build excellent workplaces that embrace, support, and promote diversity and inclusivity. Next, I would like to invite our President and CEO, Dr. Verna Yu, to share updates on our phased COVID-19 vaccination efforts. Verna?
Thank you very much, David, and good afternoon to everyone. This week, Alberta marked another milestone in our year-long response to the COVID-19 pandemic as more Albertans become eligible to book and receive COVID-19 immunizations. Covishield AstraZeneca vaccine was recently approved by Health Canada, and we received a first shipment of this vaccine just this past week. Eligible Albertans for the Covishield AstraZeneca vaccine include all Albertans born in 1957 and 1958. They are now able to book an immunization appointment using the AHS online booking tool or by calling HealthLink at 811. The other group is First Nations, Métis, and Inuit peoples born in 1972 and 1973. They are asked to call 811 to book an immunization appointment. Pending vaccine supply, Albertans born in other years will be offered a chance to book in the coming days. I'm pleased to say over the past 2 days, we have already booked over 23,000 Covishield AstraZeneca vaccination appointments. Clinics for this vaccine opened this morning, and immunizations have already begun. So we are moving quickly as we're working to immunize as many Albertans as possible as soon as possible. There are a few things you should know about the Covishield AstraZeneca vaccine. First, it is provided in a 2-dose regimen, administered 16 weeks apart. But in booking, you will only be able to book for the first dose, and reminders will be sent out to book the second dose at the later date. Initial doses of the Covishield AstraZeneca vaccine will not be available at pharmacies. Covishield AstraZeneca will be offered in communities in each AHS zone across the province. However, due to its limited supply, resulting in limited distribution, some individuals may need to travel outside of their home community if they choose to receive this vaccine. In general, Alberta Health is recommending Covishield AstraZeneca vaccine for Albertans 18 to 64 years of age without a contraindication, such as a severe reaction to a vaccine ingredient. Albertans in the target age group can choose if they want to receive the Covishield AstraZeneca vaccine now or wait until their sequenced phase to receive one of the Pfizer or Moderna vaccines. Additional information will be provided in the coming days of who will be included and the timing of the next phases of the vaccine rollout. Individuals potentially belonging to those phases, including healthcare workers, can still choose to receive Covishield AstraZeneca if eligible, and they would prefer to be immunized sooner. Like all of the vaccines currently approved for use in Canada, the Covishield AstraZeneca vaccine has proven to be highly effective in preventing serious illness and death in adults 16 to 64 years of age. We encourage all Albertans eligible to receive the Covishield AstraZeneca vaccine to speak with their healthcare provider as they consider options. And of course, we're continuing to provide COVID-19 vaccinations to all Albertans 75 years of age and older. If you aren't an Albertan 75 or older and haven't already booked an appointment, you can do so now using the AHS online booking tool or by calling HealthLink at 811. Although we're now rolling out the vaccines, it's really crucial for Albertans to know the pandemic is not over. COVID-19 and its variants of concern are still circulating, and they are still capable of causing life-threatening illnesses and putting immense pressures on our hospitals and intensive care units. So I urge all Albertans to wash your hands regularly, maintain 2 meters of distance from people outside of your household, wear a mask that covers your nose and mouth when in public, and stay aware of public health measures and follow them to keep ourselves and others safe. I know that we're tired of this pandemic and want it to end. And with the arrival of vaccines, there is now real hope to putting COVID-19 behind us. But it's not going to happen overnight, and we must remain vigilant, and we must continue to look out for one another. So before I close, I just want to say thank you to our teams for working tirelessly on the immunization rollout. There's been significant work done to stabilize and improve the online booking tool and additional improvements made to 811. And these improvements are being made as we go based on experience. I also want to really thank Albertans for responding to our requests to book using the online tool as much as possible and to be patient if there are wait times. We know that there is worry and anxiety. We feel it too, and we're here to work with all of you to make sure that everyone is vaccinated as quickly as possible. So thank you to all Albertans. And back over to you, David.
Thank you, Verna. Now let's move on with our agenda. We are participating by telephone conference today. When I ask for a vote on a motion, I will be asking for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who either oppose or abstain, I will declare the motion passed. May I ask that someone move approval of the agenda that has been circulated?
Chair, Deborah Apps, I will make that motion.
Thank you, Deborah. Will someone second the motion?
Tony Dagnoni.
Thank you, Tony. Is there any further discussion? Any opposed or abstentions? The motion is carried. Based on the approved agenda, do any board members have a conflict of interest that they would like to declare at this time?
Mr. Chair, this is Syed Al-Key. If I may declare conflict of interest.
Thank you.
Thank you. As a physician, I would like to declare a potential conflict of interest with respect to 2 items on the agenda. Item number 2, radiologist contract, and item 5F2 on Alberta Health Physician Grant amending agreements. I will be abstaining from the discussion and the vote.
Thank you, Syed. I too would like to declare a conflict on that latter motion, 5F2, Alberta Health Physician Grant Amending Agreements. I will abstain from the discussion, and I am only entitled to vote in public board meetings when there is a tie, and if that happens, I will abstain from voting. With those declarations, we move on. In board materials, there are 2 sets of minutes for approval, minutes from the January 28th, 2021 public board meeting and the February 24th, 2021 public board meeting. I have someone move approval of both sets of minutes.
Mr. Chair, it's Natalia Ryman here. I would like to make that motion, please.
Thank you, Natalia. Will someone second the motion?
Brian Vasjo, and I'll second that motion.
Thank you, Brian. Is there any further discussion? Any opposed or abstentions? The motion is carried and the minutes are approved. I now ask David Carpenter to present a motion related to the radiologist contracts.
Thank you, Mr. Chair. I've been asked to present the below motion for approval today. The board is asked to consider for approval items related to the radiologist contracts. The board has considered such contracts and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the following contracts on the terms and conditions reviewed by the Alberta Health Services Board with such non-substantive changes that management considers necessary or advisable, each of which will have an effective date of March 18, 2021. Number 1, bridging letter agreement with radiologists comprising the majority of the radiologists that Alberta Health Services contracts with. 2, bridging letter agreement with radiologists from the Alberta Children's Hospital. 3, maintenance of status quo letter agreement with radiologists in the perinatal program in the Edmonton zone. And 4, maintenance of status quo letter agreements with individual radiologists in the North Zone. And B, delegate the authority to Alberta Health Services President and CEO to execute and deliver the radiologist contracts noted above in accordance with the delegation of authority and establishment of controls for commitments policy. I so move, Mr. Chair.
Thank you, David. Will someone second the motion?
Mr. Chair, it's Deborah Apps. I will second that motion.
Thank you. Is there any further discussion? Any opposed or abstentions? The motion is carried. I will ask Glenda Yates, Chair of the Quality and Safety Committee, to present the Quality and Safety Committee report.
Thank you very much, David. The Quality and Safety Committee met on February 18th and then again on March 10th, 2021. Committee's meetings, as I think I've mentioned in the past, focus on access, quality, and safety. At the February 18th meeting, the committee received an update on the COVID-19 pandemic response and on the vaccine rollout. We also received a quality, safety, and access dashboard for discussion. The committee discussed the status of the Alberta Surgical Initiative and received an update on the strategic quality initiatives identified by the Quality, Safety, and Outcomes Improvement Executive Committee. At the committee's March 10th meeting, the committee received the Q2 2020-2021 Patient Safety Report, a report on Partnership for Research and Innovation in the Health System, and a report on process improvement for COVID-19 testing. The committee also received an update on AHS's virtual health strategy. As chair of the Quality and Safety Committee, I am presenting one motion for approval today. The committee considered for recommendation for approval the Accreditation Annual Report. Ministerial Directive D5-2008, mandatory accreditation in Alberta's health system, requires AHS to provide information on accreditation activities and outcomes and accreditation status in an annual report to the minister. Once approved, the Accreditation Annual Report must be submitted to Alberta Health by March 31st, 2021. Accordingly, I move that the Alberta Health Services Board, 1, approve the Alberta Health Services Accreditation Status and Activities for Health Facilities and Programs Annual Report, as reviewed by the Quality and Safety Committee and the Board, subject to any non-substantive changes that management deems necessary or advisable. 2, support the Board Chair delivering the report to the Minister of Health by March 31st, 2021. And 3, direct management to make the report available on the Alberta Health Services public website as soon as practical. I so move.
Thank you, Glenda. Will someone second the motion?
Natalia Ryman here. I will second that.
Thank you, Natalia. Any opposed or abstentions? The motion is carried. I now ask Vicki Yellow-Oldwoman, Chair of the Community Engagement Committee, to present the Community Engagement Committee report. Vicki?
Thank you, Chair. The Community Engagement Committee met on February 18th and March 11th, 2021. At the committee's meeting on February 18th, we received presentations from both the Alberta Cancer Foundation and the Addiction and Mental Health Provincial Advisory Council. The committee also reviewed and recommended member appointments and renewals to health advisory councils and health foundations. These appointments were approved at the board meeting on February 24th, 2021. The committee also reviewed the health advisory councils and health foundations satisfaction surveys and received a summary of the philanthropic strategy for foundation funding priorities. I am presenting one motion today for board approval. At the committee's meeting earlier today, the committee considered the reappointment of trustees to the Calgary Health Foundation. We are very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care. As is our typical practice, given the number of appointments and renewals, the names of the trustees will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly following this meeting. The responsibility to appoint trustees to established foundations lies with the AHS board. The committee recommended the board approve the trustee reappointment as reviewed by the committee. The board has considered such recommendation and the members support its approval. Accordingly, I move that the Alberta Health Services Board approve the reappointments of trustees to the Calgary Health Foundation for the terms reviewed by the Community Engagement Committee and the board.
Thank you, Vicki. Will someone second the motion?
Mr. Chair, it's Deborah Apps. I'll second that motion.
Thank you, Deborah. Any further discussion? Any opposed or abstentions? The motion is carried. I now ask that David Carpenter, Chair of the Finance Committee, present the Finance Committee report. David?
Thanks again, Mr. Chair. The Finance Committee met on February 19 and March 10, 2021. At the February 19, 2021 meeting, the committee considered the Q3 2020-2021 investment report, which is detailed below for approval. The committee also received financial updates, a budget preparation update, and a presentation on capital planning roles and the responsibilities between AHS, Alberta Health, and Alberta Infrastructure. Further, the committee reviewed the delegation of authority for amendments to continuing care contracts, which were approved on February 24th, 2021. At the March 10, 2021 meeting, the committee received an update on the development of the health and business plan and the budget approval process. The committee also received a report on the Asset Optimization Committee meeting, a subcommittee of the Finance Committee. Finally, the committee received several recommendations for approval as outlined in detail following. I am presenting 9 motions for board approval today. The committee reviewed the Q3 2020-2021 investment report. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below. A, as at December 31, 2020, AHS held restricted and unrestricted funds managed by Philip Sager and North Investment Managers and Manulife Financial totaling $882 million. B, the funds were invested in short-term treasury bills, federal, provincial, municipal, corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended December 31, 2020, were invested in accordance with the investment bylaw and investments policy.
Thank you, David. Will someone second the motion?
Brian Vazjo, I'll second the motion.
Thank you, Brian. Any further discussion? Any opposed or abstentions? The motion is carried. David, your second motion, please.
The committee reviewed an amendment to the Alberta Health Grant Agreement for COVID-19 pandemic response to increase the grant funding. The board reviewed the proposed amendments and the members support the approval. Accordingly, I move that the Alberta Health Services Board A, approve the amendment to the Alberta Health Grant Agreement for the COVID-19 pandemic response for the term April 1, 2020 to March 31, 2021, to increase the grant funding on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of AHS considers necessary or advisable, and B, delegate the authority to the Alberta Health Services President and CEO to execute the agreement to effect such amendment on behalf of the Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
Glenda Yates, I'll second that.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? Motion is carried. David, your third motion, please.
The committee reviewed the grant agreement between Alberta Health and Alberta Health Services for the one-time lump sum benefit payments to eligible workers identified as critical for the delivery of basic services to Albertans in response to the COVID-19 pandemic. The board reviewed the proposed agreement and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the grant agreement between Alberta Health and Alberta Health Services for the one-time lump sum benefit payments to eligible workers identified as critical for the delivery of basic services to Albertans in response to the COVID-19 pandemic for the fiscal year April 1, 2020 to March 31, 2021, on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management considers necessary or advisable, and B, delegate the authority to the Alberta Health Services President and CEO to execute such critical worker benefit grant agreement on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
Mr. Chair, this is Vicki Yellowold Woman. I will second the motion.
Thank you, Vicki. Any further discussion? Any opposed or abstentions? The motion is carried. David, your fourth motion, please.
The committee reviewed the 2021-2022 budget. The board reviewed the budget and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the 2021-2022 budget in the form reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. B, approve the following 2021-2022 funding amounts of the three wholly owned subsidiaries of Alberta Health Services as provided for in the 2021-2022 budget. Number one, up to $137 million of funding for Capital Care Group, Inc. Two, up to $164 million of funding for Care West. Three, up to $791 million of funding for Alberta Precision Laboratories, Ltd. C, authorize and direct management of Alberta Health Services to deliver the 2021-2022 budget to the Minister of Health for approval, and after receiving such approval, make the 2021-2022 budget available to the public through the Alberta Health Services website. I so move.
Thank you, David. Will someone second the motion?
This is Saeed Zolki. I second the motion.
Thank you, Saeed. Any further discussion? Any opposed or abstentions? The motion is carried. David, your fifth motion, please.
The committee reviewed the interim authorization to spend for COVID-19 costs in 2021-2022. The board reviewed the agreement and the members support the approval accordingly. I move that the Alberta Health Services Board authorize the Alberta Health Services to incur the following costs for COVID-19 pandemic response. A, maximum expenses of $474 million for the period April 1, 2021 to June 30th, 2021. And B, maximum capital expenditures of $15 million for the period April 1, 2021 to June 30, 2021. I so move.
Thank you, David. Will someone second the motion?
Mr. Chair, it's Deborah App. I'll second that motion.
Thank you, Deborah. Any further discussion? Any opposed or abstentions? The motion is carried. David, your sixth motion, please.
The committee reviewed the 2021-2022 interim funding for Covenant Health. The board reviewed the funding amounts, and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the 2021-2022 interim funding, acute care funding, to Covenant Health on the terms and conditions reviewed by the Finance Committee and the Board. And B, delegate the authority to the Alberta Health Services President and CEO to execute and deliver the funding letter reflecting the above to Covenant Health in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
Tony Dagnoni.
Thank you, Tony. Any further discussion? Any opposed or abstentions? The motion is carried. David, your seventh motion, please.
The committee reviewed the 2021-2022 interim funding for Saskatchewan Health Authority. The board reviewed the funding amounts and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the 2021-2022 interim funding, acute and clinical support to Saskatchewan Health Authority on the terms and conditions reviewed by the Finance Committee and the Board, and B, delegate the authority to the Alberta Health Services President and CEO to execute and deliver the funding letter reflected above to Saskatchewan Health Authority in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
Glenda Yates here. I'll second that.
Thank you, Glenda. Any further discussion? Any opposed or abstentions? The motion is carried. David, your eighth motion, please.
The committee reviewed the grant agreements for the Academic Medicine and Health Services Program, MHSP South Sector, and the Academic Medicine and Health Services Program, MHSP North Sector, and a grant agreement for the on-call programs and provision of on-call services by physicians. The board reviewed the agreements, and the members support the approval. Accordingly, move that the Alberta Health Services Board A approve the amendment to extend the term and increase the funding for the following Alberta Health Services grants on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 1. The provision of insured medical services and education, research, and leadership administrative services at the University of Calgary and at the health services facilities by physicians participating in the Academic Medicine and Health Services Program with an extension term of April 1, 2021 to March 31, 2022. 2. The provision of insured medical services and education, research, and leadership administrative services at the University of Alberta and at Alberta Health Services facilities by physicians participating in the Academic Medicine and Health Services Program with an extension term of April 1, 2021 to March 31, 2022. And 3, the operation and management of the on-call programs and provision of on-call services by physicians with an extension term of April 1, 2021 to March 31, 2022. And B, delegate the authority to the Alberta Health Services President and CEO to execute the agreement to effect such amendment on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. May I have a seconder for the motion?
Mr. Chair, it's Natalia Ryman here. I'll make that motion. I'll second that, sorry.
Thank you, Natalia. Any further discussion? Any opposed or abstentions other than the 2 abstentions previously noted? The motion is carried. David, you have a ninth and final motion.
Thank you, Mr. Chair. The committee reviewed the Alberta Health Drug Grant Amending Agreements. The board reviewed the agreements and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the amendment to extend the term and increase the funding for the following Alberta Health grants on the terms and conditions reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 1. The provision of cancer pharmaceuticals to outpatient cancer patients at no cost with an extension term of April 1, 2021 to March 31, 2022. And 2. The provision of specialized high-cost drugs, short-term exceptional drug therapy, and rare disease drugs to eligible Albertans at no cost with an extension term April 1, 2021 to March 31, 2022. And B, delegate the authority to the Alberta Health Services President and CEO to execute the agreements to effect such amendment on behalf of Alberta Health Services in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you, David. Will someone second the motion?
Brian Vaasjo, I'll second the motion.
Thank you, Brian. Any further discussion? Any abstentions or opposed? The motion is carried. David, would you also like to present the report from the Audit and Risk Committee for the February 19th, 2021 meeting?
Thank you very much, Mr. Chair. I would love to give that report. The Audit and Risk Committee met on February 19th, 2021. Standard practice is that the Office of the Auditor General and KPMG are guests at each meeting, and the role as external auditors of AHS. The committee received updates on the Office of the Auditor General's performance audits related to diagnostic imaging and continuing care. The committee also received an internal audit report on the home care contract monitoring and quality evaluation, a legal and privacy update, and the Q3 2020-2021 internal audit and enterprise risk management portfolio performance report. There were no items that came through the committee for board approval.
Thank you, David. And finally, I will ask Dr. Saye Zelke, as Vice Chair of the Human Resources Committee, to present the meeting report for the February 24th, 2021 meeting. Saye?
Thank you, Mr. Chair. The Human Resources Committee met on February 24, 2021. The committee received the Our People Results Quarterly Pulse Report, an update on labor relations, psychological health and safety, the healthcare worker COVID-19 testing dashboard, and summary report and an update on AHS workforce COVID-19 immunization. There were no items that came through the committee for board approval.
Thank you, Saye. We have reached the end of our agenda. I declare the business meeting adjourned. Thank you again for joining us, and please stay healthy.
Together, we do amazing things every day.